Hello everyone, this is Dr. Priyanka Agarwal here. In this video, we are preparing pharmacokinetics for our exam. Okay, so we are already done with absorption, distribution and metabolism in our part 1, 2 and 3 video. Okay, so in this video, we will be doing excretion and clinical pharmacokinetics. So coming to important questions, from excretion, there are no important questions from exam point of view. For clinical pharmacokinetics, there are these 3 questions. Okay, so by the end of the video, you will know exactly how to attempt these 3 questions in the exam, and you will also have exam presentable notes with you. Okay, so let's start. Coming to our first question, first order and zero order kinetics. So what does this kinetics help us to understand? What is the meaning of this? So this first order and zero order kinetics help us to understand how much the drug is given to the body and how much the drug will be removed out of it. Okay, so the relationship between the drug given and the drug removed is what we will understand by first order and zero order kinetics. So let's go to each one now. So this first order kinetics is also called as exponential kinetics. Zero order kinetics is also called as linear kinetics. Okay. In first order kinetics, it's given that rate of elimination is directly proportional to drug concentration. Okay, so let's understand this first statement with this, with these numbers. Okay, so imagine you are giving the drug as 100 milligrams and increasing it to 200 and 300. So what's given here? Rate of elimination is directly proportional to drug concentration. So whatever drug that is eliminated will be directly proportional to the drug given. That means if you are giving 100, 50 will be eliminated. If you are giving 200, 100 will be eliminated, and if you are giving 300, 150 milligram will be eliminated. So what we are understanding by this, there is constant fraction of drug that is eliminated in the unit time. So if you calculate percentage, there is a constant fraction of drug, constant percentage of drug that is eliminated in the unit time. Okay, so do you understand these two statements now? Rate of elimination is directly proportional to drug concentration and constant fraction of drug is eliminated in unit time, and this is the case seen in majority of drugs. Okay, right? Okay, now come to zero order kinetics. So what is written here? Rate of elimination is constant irrespective of drug concentration. Okay, so if you increase the dose from 100 to 100 or 300, okay, so drug eliminated is constant. Okay, so here it will be 50, 50 and 50. Whether you give 100, 200 or 300, the drug eliminated will be same. So drug eliminated is irrespective of the drug given. Okay, so that is zero order kinetics. So rate of elimination is constant and it is irrespective of drug concentration. Okay, so what is the next statement? Constant amount of drug is eliminated in unit time. So if you calculate, if you see the drug eliminated, constant amount of drug is eliminated. So in first order kinetics, constant fraction of a drug is eliminated. Okay, so constant percentage of drug is eliminated, whereas in zero order kinetics, constant amount of drug is eliminated. Okay, so that is the difference between first order and zero order kinetics, and this is the case seen in only few drugs, for example ethyl alcohol. Okay, so if we plot the graph between the plasma concentration and the dose rate, we get something like this. Now why do we get a straight line here and an upward curve in zero order kinetics? Okay, let's understand this now. So if you calculate the drug plasma concentration, like if you have given 100 milligrams, 50 is eliminated, so you get 50 milligram is drug plasma concentrations. Okay, so if you calculate with the same calculations, if you calculate all these, okay, you will observe that in first order kinetics there is a constant increase in drug plasma concentration. Okay, whereas in zero order kinetics, and the drug plasma concentration is increasing more. Okay, so that is the reason we are getting a straight line in first order kinetics and an upward curve in zero order kinetics. Okay, so I hope you understand what is the difference and what is the meaning of first order and zero order kinetics. So to recap, just remember that here the constant fraction of drug is eliminated, here constant amount of drug is eliminated. Okay, So you understood what do you mean by these, okay? But most important thing is how do you remember this? So we generally get very in exam it gets very confusing, right? So just remember easily with this tip. So write first here, first is 1, right? So it is yes. So 1 in general language 1 is yes, 0 is no, right? So 1, is it directly proportional? Yes, it is directly proportional. So it gets the score of 1, okay? So F is fraction, so constant fraction. So seen in majority of cases, so remember this, more drugs, okay? And how is the graph? It is again a straight line, okay? Done. So you will understand, you will remember now the first order kinetics, okay? Now coming to zero order kinetics, just remember it like this. So write 0 here. So does the rate of elimination is proportional to drug concentration? No. So that's why 0. Remember Z A. So A Z. Okay. So here the constant amount of drug is eliminated, and it is seen in only few drugs. Okay. And the graph, if you draw the 0, the graph is upward. Okay. Understood? Right. So this is about the first and zero order kinetics. Okay. So let's move on to the next question. So before moving to the next question, I want to share something with you.
You can also join me for customized daily classes, and with these essential resources, we will make your exam preparation smooth and successful.
Okay, so what do you mean by plasma half-life? T half. So what do you understand by this? So it is the time taken for drug plasma concentration to be reduced to half of its original value. So imagine this is your blood vessel and dots here are the drugs in the blood vessel. Okay. So what is plasma half-life? In simple words, it is in how much time, okay, in how much time drug concentration in the blood vessel will be reduced to half. 10 here will be becoming 5, okay. So it is the time taken, so it is the time taken for drug plasma concentration to be reduced to half of its original value. I think you understand it. What do you mean by this? Okay. So if you try to understand it by the graph, okay. So this is drug plasma concentration, this is the time, okay. So if the drug concentration is 4 in 6 hours, right? So by what time this 4 is becoming 2 is your T half, okay? So this gap is your T half. So 4 should become 2, okay? That will be your T half. So this is about what do you mean by this, okay? Now each drug will have its own T half. So aspirin, for example, will have its own T half. Digoxin, which is drug acting on the CVS, will also have its own T half. Okay. So for aspirin it is 4 hours and digoxin it is 40 hours. Okay. Now there is one more very interesting fact. Okay. So in the same blood vessel, if you want it to become 0, okay, if you want drug plasma concentration to become 0, it is given that it will take 4 to 5 T half, okay. So let's understand this. So 4 to 5 T half-lives are required for complete drug elimination. How? So by first half-life, 50% of drug is eliminated, right? So 50% is remaining. By second half-life, out of this 50, 25 is eliminated. So total how much is eliminated? 75%. So by third half-life, out of remaining 25, again 12.5% is eliminated. So the total becomes 87.5%. Okay, and by the fourth half-life, out of the remaining 12.5%, again 6.25% will be eliminated. So the total becomes 93.75%. Okay, so by this calculations, you understand like for the drug concentration to be completely removed, it take at least 4 to 5 half-lives. Okay, done. Now coming to the next point. So when you compare first order and zero order kinetics, in case of first order kinetics, T half remain constant, and in case of zero order kinetics, it is prolonged. Now the question is why? So let's go back to our same example. So in first order kinetics, you can notice that there is a constant, percentage of drug that is eliminated. Okay, so obviously T half will be constant because the same amount of drug is eliminated. But in zero order kinetics, it is not the case. The same percentage is not removed, same amount is removed. Okay, so that's why, because the same percentage is not removed, it is, T half is prolonged. Okay, understood? Right. So with increase in dose, in first order kinetics, T half remain constant. In zero order kinetics, with increase in dose, T half gets prolonged. Understood? Now coming to the next point, what does this plasma half life help us to calculate? So it is an important pharmacokinetic parameter, okay, that guide us. It will tell us for how much time, for how much duration the drug will act. Okay, so it will help us to decide about the dosing regime of the drug. Okay, whether you should take the drug to 2 times a day or 3 times a day. It will help us to understand this. Okay, understood? Okay, so we understood plasma half life in these 5 simple points, 1, 2, 3 and 3, 4, 5. Okay, done? Right. Now let's move on to the next question, that is the prolongation of drug action. Okay, so what do you mean by prolongation of drug action? So imagine you have a drug that is acting for 4 hours now. If you want it to act for 10 hours, okay, that is the prolongation of drug action. Okay, so modifying drug in such a way that it acts for longer period is nothing but prolongation of drug action. Now, for which drug should we do it? It is suitable for drugs with T half less than 4 hours. Okay, and it is not suitable for drugs, for which drugs, it makes sense, right, which are already longer acting, right? So with a drug who have T half already more than 12 hours, or drugs with inherent long duration of action. Okay, for example, digoxin and amlodipine. So digoxin is the drug acting on the CVS, amlodipine is the antihypertensive drug. Okay, it is basically calcium channel blockers. Okay, next, and drugs used for brief therapeutic effect. Okay, so for the drugs which are made to act for shorter action, okay, like for the sleep inducing hypnotics, they should act for shorter duration, right, and headache remedies. Okay, so they are suitable for this, and they are not suitable for 1, 2 and 3 points over here. Now what are the advantages, right? So if we prolong the duration of action of a drug, the frequency of administration is reduced. That makes sense, right? When the drug is acting for longer time, we need not take it 2 times a day or 3 times a day. If we take just once, it is enough. So frequency of administration is reduced. Because of that, it becomes more convenient and it will improve patient compliance. It will improve the patient cooperation, because patient is less likely to forget single morning dose than 6 to 8 hourly regime, right? So patient is less likely to forget single dose. Okay, now other advantages are positive is increasing, negative is decreasing. So drug effect can be maintained overnight, so without disturbing sleep. Okay, so there is no need to take the drug in middle of the night. Okay, in case of examples like anti-asthmatics and anticonvulsants. Okay, and the side effects related to high peak plasma levels. So because the drug is taken only once, the high fluctuations in plasma levels are not there. So the side effects related to high peak plasma levels soon after a dose are minimized. In case of example is nifedipine. Okay, next. So we are done with what do you mean by this and what are the advantages. So now let's understand how do you do it. So what are the methods used for prolonging drug action? So here our purpose is, our aim is to have the drug for more time in the body, right? So for that we are acting at all the 4 levels. We are acting at absorption, distribution, metabolism and excretion. Okay, so let's go to each one. So what we are doing at absorption level, so we are prolonging the absorption. We want the drug to be slowly coming to the body over a period of time. Okay, so how we are doing it? So by the oral route we have 2 things. We have sustained release tablet, we have controlled release tablet. So what is the difference? In sustained release tablet, you can see the examples here. Okay, so So this is the sustained release tablet, this is the controlled release tablet here. Okay, so what is the difference? In sustained release tablets, drug particles are covered with resins or plastic materials, okay, such that the drug is coming out of this material slowly, okay. So that will be sustained release tablets, okay. So we also have something called as pansules. Pansule is nothing but capsules with this kind of medication, okay, with this kind of sustained release medication, okay. Now what is controlled release tablets? So here the drug particles are covered with semi-permeable membrane, okay, like this. So the drug is coming out of the formulation in controlled and predictable way, okay. So that is the difference between sustained and controlled release tablet. So with these preparations we are increasing action by 4 to 6 hours, okay, done. So by transdermal drug delivery system, so we are having this patches, okay. So drug is impregnated in this adhesive patches. So like this the patches will be there where the drug is impregnated, okay. So they are applied on the skin for the longer duration of action. I am sure you might have observed this in your daily life, right. Now this is about the transdermal drug delivery system. Now coming to the parenteral route. In parenteral route, in subcutaneous injections, we have two things. We have pellet implantation and we have sialistic implantation. So in pellet implantation, what do we do? In subcutaneous tissue, in this yellow thing here, we are injecting drug in this solid form like this, okay, and it will give the absorption over the weeks, days and years, okay. And in sialistic implant, the drug is inside this plastic tubes, okay. So we have pellet implantation and sialistic implantation. They provide absorption of drugs over weeks, months or over even years, okay. And we can also add vasoconstrictors. So they will constrict the blood vessels, and because of that the drug will move slowly into the blood vessels, okay. So in dentistry we use this exclusively as adrenaline given along with local anesthetic, okay. Adrenaline is vasoconstrictor here, okay, and they also prolong the absorption. So this is about how we can do it at the absorption level. Now what can we do at distribution level? So we can make the drug highly bound to plasma proteins, okay. So as we already know, if the drug is bound to plasma protein, it will be it will be released very slowly, because only the free drug that will go out of the blood vessel, okay. So drugs highly bound to plasma proteins, for example sulfadoxine, are released slowly in free active form, okay. Now coming to metabolism. So what do we do? So there are some small chemical changes that can be done to the drug that will retard the metabolism. Like for example, addition of ethinyl group to estradiol, okay, will make it longer acting and suitable for use as oral contraceptives, okay. So this small chemical change will retard the metabolism and make the drug longer acting. And sometimes one drug can inhibit the metabolism of other drug, okay. How? By acting at some specific enzyme, okay. For example, allopurinol inhibits the metabolism of 6-mercaptopurine. So all these are nothing but anti-cancer drugs, okay. Done. Now what are we doing at excretion level? So we are retarding the excretion, okay. So by that we are letting the drug to be in the body for longer time, okay. So how do we do it? By suppressing tubular secretion. Now what do you mean by tubular secretion? Tubular secretion is nothing but, you can see in the diagram, from the blood vessel drug is coming into the nephrons, okay. So this is called as tubular secretion. In the tubule drug is coming into, okay. So if we suppress this, drug is there for the more time into the blood, okay, and it will be acting for the longer time, right. So by suppressing tubular secretion of drugs, renin excretion can be retarded, okay. This the example is probenecid, which is blocking the tubular secretion of penicillin and ampicillin and prolong their duration of action. Penicillin and ampicillin are nothing but antibiotics. Okay, so I hope you understand everything written here. So so to recap the prolongation of drug action, so we did what do you mean by this, for which drugs we do it, what are the advantages of this, right? So we did what are the advantages of it, and then we saw how do we do it. Okay, so at absorption level we prolong the absorption, we increase the plasma protein binding at distribution level, metabolism is retarded and excretion is also retarded. Okay, this is about prolongation of drug action. So if you want to check out other videos, you can click here on the screen. Okay, so that's it for the pharmacokinetics. In next video we will see the pharmacodynamics. Okay.